Hello, this is Katie Adams with MedCity News, and I'm here with Jeff Como, Strategic Advisor for Hospitals at ImageTrend. Thanks for being here today.
Yeah, absolutely.
I want to know a little bit more about your background. Can you tell me about how your work as a former fire chief and paramedic has led you to this work you're doing today at ImageTrend?
Right. Yeah, it's a good question. So, yeah, I started in the fire service right out of high school. You know, I just kind of got sucked into the fire service. I loved it. When I was a medic, we were actually doing a lot of our patient care reports on paper when I started out. Nothing was digital. Nothing. We had a hard time finding data. And as I worked my way up through the ranks, we were able to switch to data platforms to grab all that data, which was really nice for us. But as a fire chief, data really drove all my decisions. So when I'm looking at resources, staffing, funding, all those type of things, data really played an important role in that. That's what I really like about my work at ImageTrend now. I'm able to work with hospital systems, EMS systems across the country with data to help drive their strategic plans, what they want to do in the future.
Interesting. So when it comes to this current moment in emergency services and emergency services operations, where do you think data analytics, interoperability has the most opportunity to improve things?
Yeah, it's a great question. I think right now it's interoperability around siloed systems. So right now hospital systems don't talk very well to EMS systems. The data doesn't intertwine between the two very well. So when EMS does data, it's tied in a silo. When hospitals do data, it's tied in a silo, and they don't really talk to each other. So one of the things we do great at ImageTrend, where I think stuff's trending right now, is ability to get rid of those silos, where the data flowed smoothly from EMS into hospital systems and out of hospital systems back to EMS systems, so they can work on process improvement issues, growing community health, really the overall continuum of healthcare. And that data brings those two together. So I think that's where our big opportunity is right now, is trying to knock down those silos and make the data flow more smoothly between the two.
I wonder if you can share any examples of maybe a time where data or insights from these EMS systems were able to kind of produce a tangible improvement, maybe to patient care, to resource allocation.
Right, that's a good question too. So I think from a hospital standpoint, right, you look at where patients come from, and the ED is the gateway into a hospital system. So when you look at that, the EMS, when you're looking at EMS transport data within a market, you're really able to see what is real world compared to what the perception is out there for a hospital. So in a case, when I talk about that, a good example would be around stroke patients. So a hospital was looking that they were losing high acuity stroke patients. They were actually being bypassed. And the reason for that was because of some CT turnaround time issues. So once leadership at a hospital was able to see that, they were able to take the EMS transport data that they were seeing, that they were trending, overlap that with their internal matrix within their own hospital system. And in turn, they were able to see, okay, we can change some efficiencies. We can change the way we offload EMS. We can change the way we're doing our activation protocol. And when they started to do that, what they noticed was that their rates for bypass started to drop, and the patients started to return, and their efficiency around taking EMS back in on those type of patients was actually a better process. So tangibly, when you're looking at that, that's an impact of where you're seeing better outcomes really driven by EMS data. So that's just kind of an example we have.
There you have it. Data can help save lives.
Yes, it can. Absolutely.
Awesome. Well, thank you so much for sharing that. And thank you for being with us here today.
Yeah, absolutely. Thanks for having me.